Hey everybody, welcome back to Built for Medicine. I'm Dr. Corbin.
I'm Dr. Madrano.
And today we're going to talk about, is medicine right for you? All right, Damien, tell me a little bit about challenging patients and valuing relationships.
The most fulfilling aspect of medicine is being able to help people, right? That's what fulfills doctors. That's what keeps them going. So if you're someone who really likes developing that relationship with people, this is a career to think about. However, you do have to consider, in some instances, you're going to be interacting with people on what is going to be their worst day in their life, right? Someone who's just coming in to the emergency room and they've got this really, really dire medical situation, right? If you can handle that, then medicine may be the right choice, but if not, there may be other career options for you. Another thing to consider, sometimes patients can be challenging and difficult and mean and so on. So you're gonna have to be professional at all times, and you're gonna have to deal with sometimes patients who don't have a lot of knowledge and maybe have high expectations for what exactly you're able to do treatment-wise, okay? So that's also very important to consider.
Yeah, and you have to remember at the end of the day, what makes medicine so beautiful is that humans are humans, right? We see more AI, we see more, of our social media and stuff, but people are people. And that means you can't treat them like robots. And if you want to be in medicine, you have to understand that you're dealing with actual people. And so that to me is part of what's so great about it. So the next thing we want to talk about is giving bad news. Tell us a little bit about that.
Yeah, so you're gonna have to give bad news for most people, right? So this really starts at the medical student level. Even as medical students, you will be in situations where you're gonna give difficult, bad news to patients. You're gonna have to call their families and give bad news to their families. Okay, so if you're someone who is able to deal with that, medicine is right for you, but chances are many of you haven't done that yet. So just know in medical school, you get practice. It does get easier giving bad news to people. If you're someone who maybe you've had an experience with that and you just feel uncomfortable, or you're someone who just doesn't like to feel uncomfortable and be in uncomfortable situations, then it may be a little bit challenging for you going through this career.
Yeah, giving bad news is one of those things that, is unique to being a physician, right? We talked about dealing with patients on their worst day. And, a lot of times people are looking at you for all of the cornerstone of information on themselves, on their family members, and you really need to take the time to prepare yourself before meeting with the patient. How are you going to lay out this information so that when they think about this, or if a family member thinks about this 5-10 years down the line, you're not associated with being rude or arrogant or not caring, and rather, hey, this person took the time to really think about me and my family members through this difficult time.
Another thing you should think about when thinking about is medicine right for you are the risks, the complications that just come with being a physician, right? So this is just doing your due diligence, doing your homework to know, what exactly are some of the risks with giving a patient a particular treatment, a procedure, a surgery, having that in the back of your head so there's no surprises. Obviously, we're all trying to do our best as physicians, but sometimes bad things do happen, and some of these things are out of your control. You can be doing all the right things for a patient and still have a bad outcome. And that is just something that you're just gonna have to cope with. And it can be difficult because we see these as failures. There's a lot of failure in medicine, but failures will make you better throughout the process. It's just a matter of how you deal with these throughout your journey.
And this leads us into our next topic, which is moral injury. This can be a very challenging thing for clinicians because a lot of times we might see what we want to do that's the right thing, but we're not able to do it. or we try to do the right things and there are things in the way preventing us from being able to do it. And it can cause a lot of internal kind of conflict where you can see what you want to be able to do, but you can't do it. That's a part of medicine that we try to improve upon at a system level, but it's still something that's very much apparent in medicine. You'll hear about it a lot, and it can make for a very challenging time, and we just have to work through it.
The next thing is family planning. And just thinking of this career trajectory is pretty long. So you're talking about getting a bachelor's, which could take up to 4 years. You're talking about medical school training, which is up to 4 years. Then you're talking about residency, which could be 3 to 7+ years. How that all fits into your timeline of when you decide to get married, have kids, and things like that. So just things to consider. We've seen people do it. We know residents currently in our program who have children. It can be done, but I think it can be very, very demanding trying to do all those things. And depending on who you are, with how much support you're getting, all these things will sort of play into really managing all these things when it comes to family planning, doing it well, and being happy throughout your journey.
And finally, we want to end on healthcare politics. This is something that a lot of people who are not in medicine don't see. They don't know that it exists. And it can make for a very challenging time when you're dealing with patients, because the thing that you want to, the test that you want to order may not be covered by insurance. The change you want to make at a maybe department level has to be implemented at a systemic system level where there's 10 different committees that you have to talk to before you can implement it. And so healthcare politics can, again, add to that moral injury. It can add to the complexity towards your day. But it can also be a source of where you can make a difference, right? Because if you do make a change at a system level, now you're having an impact on a grand scale that is not just you and the patient. And so these are things that we consider about whether or not medicine is right for you. And we hope that you guys have learned something. If you found it valuable, if you like this, please like, comment, share, and subscribe.